Welcome to this unique hair care initiative by IFCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, hair problem was associated with middle age when you used to lose hair or have thinning of hair and bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well, and much of the hair loss can be avoided and can be managed by managing to fixing our faulty lifestyle. Today, we have with us Dr. Radhika Barde, is a well-known doctor, dermatologist, aesthetic dermatology, and hair transplant surgeon. She is currently practicing at Nagpur and Chandrapur at Radiance Skin and Hair Transplant Clinic. Dr. Radhika Barde has dedicated her career to diagnosing and treating a wide range of skin and hair condition problems. While providing personalized healthcare services to her patients, she takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Radhika Barde is aware of the need for the patient awareness and education about hair care and has spent a lot of time in giving talks across various platforms. Thank you, Dr. Radhika Barde, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Thank you, Mona. Thanks for inviting me.
Dr. हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया.
Thank you.
So, Doctor, today we are going to discuss about hair care in current scenario. So, whenever we talk about hair care, the most common problem which is faced by all of us is the hair problems. So, irrespective of gender or age. So, Doctor, when to be concerned for and what is normal?
Okay. So, see, every individual head carries 1 to 1.5 lakhs of the hair follicle, and each strand is going to fall eventually and is going to replace by the new one. This is a normal natural process which is going to happen with everybody. So 0.1% of the 1 lakh follicle, that is equal to 100 hairs. So losing of 100 strands per day is absolutely normal. So, but at the same time, every individual follow its own trend of hair fall. Like some person is losing 10 to 20 hairs per day, and someone is losing 60 to 80 hairs per day. So deviation in the trend means the person is losing 10 to 20 hairs per day. Now he or she is losing 60 to 80 hairs per day. So this deviation, so this is a point when one should concern about the hair fall and get herself or himself evaluated by the special one.
Okay, so more than 100, 150 is like abnormal, and it is a sign that we should visit a doctor.
Yes.
Okay,
yes.
So doctor, okay, now we know that alarm sign, but what are the general causes of hair loss? Why hair loss happen?
So the causes of hair loss are plenty. We'll start with the commonest one, which is a nutritional. So as you all know, hair is basically made up of the protein, keratin. So deficiency of protein and deficiency of other vitamins and trace element will definitely cause to the hair loss. Then in addition to that, hormonal changes which occurs in the body, which are caused by the hypothyroidism, hyperthyroidism, yes, at the age of menopause, in cases of post-pregnancy, and of course in polycystic ovarian disease, where hormonal imbalance occur and then lead to the hair fall. Then, of course, stress is an important factor nowadays. Stress either in the form of the physical or the mental. So physical can be due to the surgery, then any infection or any systemic illness which patient suffering from. And then the mental stress, like the stress of study or stress at the workplace. So they contribute a lot. So this stress basically release the hair follicle from the anagen. Anagen is a growth phase. So release follicle from the anagen phase to the telogen phase. That is a shedding phase. So of course, stress play an important role in hair fall. And next, yes, lifestyle changes, the environment in which we are living, of course, how we eat, the time of sleeping, duration of sleeping hours, definitely they also contribute to the hair loss. And another one important is the genetic one. So nowadays most of the young populations are getting affected by the genetic hair loss, that is the androgenetic alopecia. Both the male and females are affecting. So in androgenetic alopecia, hormonal is the important factor, is a culprit. Okay. So wherein the hormone act at the root level of the hair and make it thinner day by day. So you will observe that your density of the hair is decreasing day by day. Thickness of your hair shaft is decreasing, and eventually the baldness will be visible.
Okay. So, doctor, like you said, stress is a very important factor for hair loss. So, can a person lifestyle also play a role in a hair loss, like sleeping late hours, not eating properly, and working too
Yes.
hard?
Yeah, yes, definitely. Lifestyle play important role not only in the hair health but also in the general body health also. So, working for late hours, then inadequate sleep, then lack of exercise, then eating junk food. These factors play a lot in hair health, or you can say causative factors for hair fall.
Okay, so now, doctor, we know the causes. We also like, can you please enlighten us, like, what are the medical treatment options available for hair loss, like topical or like surgical or non-surgical, or are there some oral also which we can take and manage our hair loss problem?
Yes. So, see, if we have to treat a hair loss, then we have to find a root cause. It's not like that every treatment or every oral formulation or solution will work for everybody. It is a tailorized treatment. It is not same for everybody. It varies from person to person. So definitely we have to first find the cause of hair fall, and then while talking medication part, of course, in lotion form, we can use minoxidil and other molecule like the Radiance, then Procapil. Then lots of peptides are also available which help in hair growth. Then in oral medications, we can use biotin or various vitamin supplements and minerals. And of course, nutraceuticals, which will help to grow our hair. And if the patient is having advanced grade of baldness or advanced grade of hair fall, then we can suggest the procedures like derma roller, then PRP, platelet rich plasma, mesotherapy, and even we can do threads in case of androgenetic alopecia. But see, these procedures will work where the hair roots are present. It's not going to give beneficial effect on the completely bald area. So keep in mind that these procedures will work on the part where hairs are present. Yes, hairs will be thin. Our aim of doing this treatment is to make thin hair thick.
Mhm. Okay.
And if advanced grade of alopecia, androgenetic alopecia, then we can plan hair transplant also.
Okay, so the person
Hmm.
who don't have like hair or a bald or a patchy hair area, they can
Yes.
go for a surgical. There are options also for.
Yes, and if the patient wants, some patients are desiring of having lower hairline, then also they can plan hair transplant.
Okay. So, Doctor, interesting. So, Doctor, there is one word called nutraceutical, which is, nowadays getting a lot of focus. So, can you please enlighten us what is nutraceutical and what is the role of nutraceuticals in our hair health?
So, nutraceuticals are basically certain nutrients which are required in very small quantity, but of course they are having a big role in hair health and of course the health of our body. So, nutraceuticals mainly consist of the essential amino acid, then micronutrients, macronutrients, various vitamins, then trace elements. And due to deficiency of this, yes, you can expect hair fall. They are basically important for the hair growth and hair health.
Okay. So, doctor, can you also please help us to know that which are some of the herbal or like plant extract or phytoconstituent which are used in the management of alopecia or you can say hair loss?
Yes. So there are various plant extract or herbal extract which are available in different combination, like grape seed extract or green tea extract, which are natural antioxidant and of course having some anti-androgenic property too. And the next one is the saw palmetto extract, which is a good natural antioxidant, and of course it will prevent the action of hormone at the local level. And ashwagandha, yes, ashwagandha is also having an important role in hair growth. It reduces the level of cortisol in the body.
Okay, so there are like quite wide range of nutrients available which are helpful for us. So,
Yes,
doctor, like there is also called a word called omega-3 fatty acid. So, the what is this? Like, are this also a plant extract or and do they promote hair growth?
yes. Omega-3 fatty acid, basically what happened in our body, there is a oxidative stress. And omega-3 fatty acid is having capacity to battle with those free radical. So it will definitely decrease the oxidative state and promote the hair growth.
Okay. So, doctor, like you have said, so many nutrients are available. So, like there are micro, macro nutrients. So, can you please let us know that what is the importance of macronutrients, or what is the role of micronutrients in hair health?
So yes, micronutrients means the nutrients which required in small quantities, like the trace element like selenium, copper, magnesium, zinc. These are essential for hair health and hair growth. And of course, the deficiency of these micro elements will definitely affect our hair health.
Okay. So, doctor, another question comes up, like there are so many nutrients also available on internet. So, can we just, take them directly, like without self prescription, like, and is it or it is required to take these nutrients as per gender RD requirement?
No, see, you just can't take any medication by yourself. The medication should be monitored by the doctor or the expert one. So it's not like that you are having only beneficial effects of vitamins. Of course, there are adverse effect too. Adverse effect like let's say vitamin B and vitamin C, which are water soluble vitamins. So if you take them in an excess quantity, then there will be no harm because they are going to they are water soluble. They are going to excrete with the help of urine only. But the water insoluble vitamins like vitamin A, D, E, K, these are water insoluble. They are going to store in your body, and of course, they will cause side effects in the form of aloe, hair fall, body rashes, like that.
Okay, so it is required. We should take it as per, whatever the guidelines say, and we should visit the doctor and then take all these nutrients.
Yes, yes, yes. Don't take anything randomly.
Okay. So, doctor, like you have earlier said as that stress is an important role in hair loss, and one of the like जब हम घर पर होते हैं स्ट्रेसफुल होते हैं तो हमारी मम्मियाँ कहती है कि ऑयल लगा लो, ऑयल की चंपी कर लो, बाल भी लंबे हो जाएंगे, बाल शाइन भी करेंगे. So, doctor, is it like oiling hair is a boon or a ban?
See, oiling hair, uh, first we will see, hair is having its own oil producing gland. So no extra oil is required for hair. So no oil is required for scalp. You can apply oil to the hair shaft. It will give a good conditioning effect, but no need of oil to the scalp. For this reason, and also oil will increase the population of fungus which resides on everybody's scalp. And of course, you need to use very strong shampoo to get rid of that oily and stickiness. So again, you will landed with a dry and itchy scalp.
Okay, so it is a myth that oil can actually help in hair growth.
Yes, you can use just for relaxation and pampering purpose, but otherwise not required at all.
Okay. So now, doctor, can you please give us some important tips for healthy hair?
So see, healthy hair comes from inside. So you have to improve your nutrition. You have to add nutritious things in your diet, like the protein, uh, then vitamins, then trace elements, then nutraceuticals. Basically, you have to add these things to your body. Then second one is you have to clean your scalp. आप स्काल्प जितना क्लीन रखोगे उतने आपके बाल हेल्दी रहेंगे. So wash your scalp or hair 2 to 3 times a week. This is for normal people, but if you are having a oily scalp, then you should increase frequency up to 4 to 5 times a week. And of course, if you are having a dry scalp, then you can minimize to twice a day. Then choose shampoo according to your scalp. If you are having a very dry and itchy scalp, then go for a hyaluronic acid based shampoo or aloe vera containing, glycerin containing shampoo. They will give you a beneficial effect. And if you are having a oily scalp, then of course you have to use a sulfate containing shampoo. See, sulfate free shampoo, it's not true. Sulfate is a scalp cleanser, so you have to use at some point. When people are having oily scalp, then that will be beneficial for them. So you have to use shampoo according to the scalp. Then use a wide tooth comb to brush your hair. Then don't use heat dry. Let the air dry by own. Don't use any extra heat like straightener or curling devices. They will damage to your hair. And of course, uh, use a healthy lifestyle, like the lifestyle modifications. Take adequate sleep of 6 to 8 hours, then drink appropriate water, and try to avoid junk food. Take nutritious food in diet. And of course, it is important to use conditioner after shampoo, because conditioner will definitely decrease the interfiber friction and make them more softer, more shinier, give lustrous to your hair, and definitely make them more manageable.
Thank you, doctor. So this discussion was very informative, and I'm sure our viewers would be benefited by it. So, doctor, can we take some questions from our live audience, please?
Yes, fine.
Okay, the first question from our live audience is, Doctor, I'm 32 years male, having gray hair, having habit of plucking gray hair. Some
Mhm.
people say it will come more if you pluck the gray hair. Is it true? And how should I prevent my hair to become gray?
So see, our hair is originally white or gray. The cells which sits besides our hair, that is a melanocyte, color giving cells, give color to it, and that's why we are having black or brown color of hair. So these cells stop producing color or cell dies because of the factors like it can be a genetic or due to smoking, due to stress, due to nutritional deficiency. So if you are having a gray hair, and if you are having these kind of habits, so stop smoking, then improve your nutrition. And if it is genetic, then no option available with us. So yes, we can do these things.
Okay, but डॉक्टर एक बार ग्रे हेयर आ जाते हैं तो रिवर्स नहीं कर सकते.
No, see, the only treatable cause is a nutritional deficiency, and that is up to mostly 25 years of the age. We can uh, stop, or we can delay the graying of hair, but we just can't make them like the original colors without coloring.
Okay, another question from our viewer is, डॉक्टर मुझे किसी ने कहा होम रेमेडी जैसे कि अनियन का जूस लगाने से, लेमन का जूस लगाने से बाल अच्छे ग्रो करते हैं। और मेरा पैची हेयर है, तो क्या मैं लगा के ग्रो कर सकता हूँ?
No, basically these home remedies, I don't know to what extent they work, but they definitely cause side effects like the irritation and itching. And if you are already having a dry and sensitive scalp, then no, don't use these things.
Okay, so these home remedies are actually not helpful at all. We should visit doctor.
Yes.
Okay. Doctor, I live in another question is, I live in a out of India. It is a cold region. So doctor, in cold, before in India, my hair was not frizzy, but nowadays my hair are frizzy and they are falling. So is it because of the weather change or I have some deficiency?
So yes, weather change can also be the factor for hair loss because frizzy hairs are difficult to manage. They break down very easily. So that can be the cause. And to, of course, manage your frizziness or decrease your frizziness, you can oil your scalp, but make sure that don't leave it overnight. Just wash 2 to 3 hours after oiling, and make a habit of using conditioner, and of course you can use leave-in serums also to make them more manageable and less frizzy.
Okay. Another question is, doctor, I was having gestational diabetes during my pregnancy, and after my pregnancy, I started having so much of hair loss. So, is it because of the diabetes or because of my pregnancy?
See, postpartum hair loss is a known cause of hair loss. So, after 2 to 3 months after pregnancy, when the hormone just started dropping, so in pregnancy, she might have experienced very good hair health. So, after pregnancy, 2 to 3 months, every female experienced hair loss, and that is due to the hormonal imbalance only. But that is recoverable, no need to worry.
Okay, so every pregnancy do have a hair loss. It is not something like problem of hair.
No, no, no. That is recoverable, not an issue. That happens due to the hormonal changes in the body.
Okay. Okay. Another question from our viewer is very interesting. Doctor, can I do hair spa and help to grow my hair?
Frankly speaking, hair spa is just for relaxation and pampering session. No effect on the hair growth.
Okay. Another question is, Doctor, I got COVID in 2020, and after that, I am just facing hair loss. And I checked my vitamin deficiency, but my vitamin levels are fine. So it is why it is because of COVID.
Yes, see, after COVID, most of the people have experienced hair fall, and as I said previously, infection is a important cause for hair fall. And after infection, like we call that situation as a telogen effluent, where the patient experience hair fall 2 to 3 months after the infection or that incident. So when that telogen effluent phase was going on, and if some any other contributory factor get added like the nutritional deficiency or any kind of stress, then that vicious cycle start where your hair cycle doesn't regularize, and that acute telogen effluent get converted into the chronic telogen effluent where your hair cycle get disturbed, and that might be the reason that she was having or she is facing hair fall since 2020.
Okay. So after COVID, we can have a hair loss.
Yes.
Okay. Okay, doctor. Another question from a viewer is, Doctor, I did keratin treatment, and because my saloon people said it is good for my hair, but now after 6 months, my hair is losing like anything. So what should I do?
See, in keratin, they are like that. They are using protein, keratin protein, but at the same time they are using that straighteners too. They are of course using a very high amount of it, so definitely that will damage to the hair. And this is a well-known cause of hair fall after procedures like the straightening, keratin, hair botox, smoothing. You can expect hair fall like 6 to 8 months after these procedures. So it is better you consult dermatologist and get yourself evaluated if any other factors are also responsible for the same.
Okay. Another question from a viewer is, डॉक्टर मेरी बीवी अपने आप ही बाल तोड़ती रहती है स्ट्रेस में, तो ये क्या उसकी कोई साइकोलॉजिकल बीमारी है स्ट्रेस के कारण, या फिर क्या प्रॉब्लम है? क्या आप प्लीज हेल्प कर सकते हैं?
I didn't get. Can you read it again?
He said that his wife break her hair by herself
Yes,
in
yes,
stress. So it is
yes.
because of a psychological problem, or she has some hair problem?
Yes, this condition is commonly called as a trichotillomania, where patient used to pull our own hair. Yes, this is due to the stress. So it is better consult dermatologist or psychologist,
Okay, and
psychiatrist.
the hair which she break by unknowingly or knowingly can grow back with help of dermatologist.
Yes, yes, they can grow.
Another question is, doctor, I have too much of dandruff, so can you please let me know how should I tackle my dandruff? And because of that, I am also having hair fall. So can dandruff cause hair fall?
See, directly dandruff and hair fall, there is no direct relation, but indirectly, yes. Because when you are having dandruff, you are having habit of scratching it all the day. So definitely inflammation and that traction kind of thing will definitely cause hair loss. And when you are suffering from dandruff, you have to use or you like to use some stronger shampoos that will definitely again cause a hair loss. So direct relation नहीं है dandruff and hair fall का, but indirectly yes, if you are having a dandruff then 25% of the patient में ऐसे रहता है कि dandruff है तो they are suffering from hair fall.
Okay. Okay. Another question is, doctor, I'm taking blood thinner medicine, and are those medicine can cause hair loss, because after starting those medication, I'm facing too much of hair loss.
Yes, blood thinner medicines like they are a known cause of drug induced hair fall.
Okay. Another very interesting question is, doctor, I want to lose weight because I'm overweight and I started
Mm-hmm.
crash diet, but
Mm-hmm.
after starting my crash diet, I'm started to see hair loss. So is it because of my dieting, or should I visit to the doctor?
क्रैश डाइट जब हम करते हैं तो बहुत सारी चीजें हम ऐसे रहता है कि हमें बहुत जल्दी वेट लूज करना है, हम बहुत सारी चीजें एक्सक्लूड करते हैं, प्रोटीन न्यूट्रिशन ये हमें कुछ नहीं मिल पाता, तो क्रैश डाइट की वजह से हेयर फॉल डेफिनेटली होता है। तो ऐसे कुछ भी डाइट करना जरूरी नहीं है, एक आप डाइटिशियन से प्लान लीजिए जिसमें वो आपको आपका डेली कैलोरी इनटेक कैलकुलेट करके देंगे, उसमें फिर अकॉर्डिंग टू दैट दे विल ऐड न्यूट्रिशियस थिंग्स आल्सो। इट्स रैंडमली डाइट करना मतलब सिर्फ आधी रोटी खाना, थोड़ी सब्जी खाना, दिस इज नॉट डाइट।
Okay. Okay, तो खाली पेट रहने से बेटर है कस्टमाइज डाइट प्लान
यस
लेना.
यस।
Okay, doctor. Another question is, doctor, is it possible to reverse hair damage caused by heat?
Not 100%, but yes, to some extent we can.
Okay, the same person is asking, डॉक्टर किसी ने कहा पीआरपी से ये हीट डैमेज कम हो सकता है और मेरे को पैची हेयर भी हो गया है, तो क्या पीआरपी क्या होता है और क्या ये कर सकता है ठीक मेरे बालों को?
PRP इज अ प्लेटलेट रिच प्लाज्मा, जहाँ पे हम आपके ब्लड से इम्पोर्टेंट ग्रोथ फैक्टर सेपरेट करते हैं विद द हेल्प ऑफ मशीन, और वो फिर स्काल्प में इंजेक्ट करते हैं। तो ग्रोथ फैक्टर जो रहते हैं डेफिनेटली दे विल हेल्प इन हेयर ग्रोथ एंड टू मेक हेयर थिक, टू रिवर्स योर हेयर डैमेज टू सम एक्सटेंट। नॉट लाइक दैट कि जैसे मैंने आज एक पीआरपी का सेशन ले लिया तो 100% मेरा हेयर वॉल्यूम वैसे ही वापस आया जाएगा, ऐसे नहीं है। इट इज नॉट लाइक दैट।
मतलब डेडिकेशन के साथ थोड़े सीरीज ऑफ ट्रीटमेंट लेने पड़ेंगे।
यस यस।
डॉक्टर, इंस्टाग्राम में एक मेडिसिन है, कहते हैं वो डिटॉक्स मेडिसिन है, तो वो लेने से बाल डिटॉक्स हो जाते हैं, तो क्या मैं वो ले लूं, क्योंकि मेरे बाल पोल्यूशन से बहुत खराब हो गए हैं।
नहीं, ऐसे इंस्टाग्राम से कुछ भी देख के वो बहुत एक्चुअली पीपल बिलीव करते हैं, क्योंकि वो बहुत अनरियलिस्टिक रिजल्ट्स दिखाते हैं कि ऐसे था पहले, अभी ये सॉल्यूशन या ये ओरल सप्लीमेंटेशन लेने के बाद में ऐसे हो गया। लेकिन ये सब ऑल द ग्लिटर इजंट गोल्ड, ये हमें समझना चाहिए कि हर जो चीज दिखाई जाती है वो बराबर नहीं रहती है। तो डिटॉक्स सॉल्यूशन, उसमें पहले हमें देखना चाहिए कि उसमें कौन से न्यूट्रिशियस है, न्यूट्रास्यूटिकल्स, कौन से विटामिन है, कौन से एलिमेंट्स है, क्या क्वांटिटी में है। अगर ये सब चीजें हेल्थ हेयर को हेल्प करने वाली अगर चीजें उसमें है तो देन फिर हम सोच सकते हैं। लेकिन अगर उसमें ऐसे ही रैंडमली कुछ है और दे आर क्लेमिंग कि ऐसे हो जाएगा, देन ऐसी चीजों से दूर ही रहना चाहिए।
Okay. Okay. Another question is, doctor, I have androgenic alopecia and I'm taking some medication, but can you please help me to know what kind of treatments I can go and where can I visit you?
Okay. See, androgenetic alopecia यह एक ऐसा प्रॉब्लम है, इट इज अ लाइफ लॉन्ग प्रॉब्लम। इट्स नॉट लाइक दैट कि somebody is coming, some patient is coming with androgenetic alopecia and I give him or her a treatment of 6 months or 1 year, तो ये कम होने वाला है, ऐसे बिल्कुल भी नहीं है। बिकॉज द प्रॉब्लम इज जेनेटिक एंड हॉर्मोन। तो जेनेटिक फैक्टर, जेनेटिक मटेरियल जो हमें मिला है फ्रॉम द फादर, मैटरनल साइड और पैटर्नल साइड, हम उसे चेंज नहीं कर पाते। एंड द सेकंड वन इज अ हार्मोन। सो हार्मोन जो यहाँ पे एक्ट होने वाला है ये उसका साइड इफेक्ट है, बट हार्मोन हमारी बॉडी डेवलपमेंट के लिए इट इज इम्पोर्टेंट। सो जब हम ट्रीटमेंट की बात करते हैं एंड्रोजेनेटिक एलोपेशिया में, तो इसका ट्रीटमेंट बहुत लंबा चलता है। इसमें जैसे हम जो भी लोशंस फॉर्मुलेशन जो प्रिस्क्राइब करते हैं, फॉर एग्जांपल मिनॉक्सिडिल, तो हम पेशेंट को बोलते हैं कि ये आपको जब तक आपके सिर पे बाल चाहिए, till the time you want hair on your scalp, you have to use this one. There is no other option. और जिन्हें एंड्रोजेनेटिक एलोपेशिया है तो ट्रीटमेंट जो है ये डिपेंडिंग ऑन द स्टेज, जैसे आप कौन से स्टेज में पे हमारे पास या डॉक्टर के पास आ रहे हो, डिपेंडिंग ऑन दैट स्टेज ट्रीटमेंट विल वैरी। कई कई बार ऐसे होता है कि पेशेंट बहुत बार स्टार्टिंग जब एंड्रोजेनेटिक एलोपेशिया या उनका हेयर थिनिंग स्टार्ट होता है तब अगर आता है तो देन वी कैन मैनेज विद द हेल्प ऑफ मेडिसिन ओनली। But if they have lose 30 to 40% of their hair and baldness is visible, then we can plan procedures as I previously told, like the derma roller, PRP, mesotherapy. They will be beneficial to them. And if the patient came with the severe baldness, severe grade like 4 5, and then he want hair to regrow on that bald patch, then transplant is the only option left with us. So depending on the stages, treatment will vary. But of course, solution part, आपको जब तक बाल चाहिए तब तक लगाना ही पड़ेगा। There is no other option to that.
Okay. मतलब अगर सारे बाल खत्म भी हो गए तो भी we have options, ऐसा नहीं है कि options ही नहीं है।
Yes, but also उसमें भी दो बातें हैं। Transplant, in transplant we are not going to make new hair, we are just reshuffling, we are just shifting hair from donor area to the recipient area. तो जब हम ट्रांसप्लांट के बारे में सोचते हैं तब हमारे पास उतना डोनर एरिया भी रहना चाहिए। ऐसे नहीं है कि मेरे पास थोड़ा सा ही डोनर एरिया है और रेसिपिएंट एरिया जो बॉल्डनेस एक पैच है वो बहुत बड़ा है, तो उसमें मैं कैसे भी करके लगा दूं। योर पर्पस विल नॉट सॉल्व बेसिकली। Then that time patch and wigs will work well.
Okay.
Yes.
Another question is, doctor, my daughter is 12 years old and she goes to school, but she is having gray hair. So
Mhm.
she's not aging, she's just 12 years old. Why she's having gray hair? Or is there some treatment for her?
Yes, definitely. At the age of 12 year, most common cause is a nutritional deficiency. So you have to check whether her nutrition is correct or not. And if any deficiency is there, then we can correct according to that.
एंड ये जो यंग एज में सफेद बाल आ जाते हैं इनको रिवर्स कर सकते हैं?
Young age में सफेद बाल, yes, reverse no. We can prevent further hairs which are getting gray.
Okay. Okay. Doctor, I'm a gym trainer and I keep on doing exercise every day, and I'm a
Mhm.
female. So, should I need to wash my hair every day, or I just have to wash 1 or 2 days, but my hair gets sweat a lot of?
देखिए, जो पेशेंट में बहुत ज्यादा स्वेट आता है उनको डेली हेयर वॉश करना बहुत जरूरी है, बिकॉज स्कैल्प जितना आप क्लीन रखोगे उतने आपके हेयर्स हेल्दी रहेंगे. सो हाँ, पेशेंट अगर फीमेल है तो आई कैन अंडरस्टैंड इट इज वेरी डिफिकल्ट टू वॉश हेयर डेली. सो यू कैन मेक इट अल्टरनेट डे ऑल्सो. And
Okay.
keep in mind that if you are washing your hair daily or alternate, use mild shampoo. Use baby, you can use baby shampoo also. Don't use harsh or sulfate containing shampoo.
डॉक्टर, आपने बोला ऑयल लगाने से बाल ग्रो नहीं करते, तो क्या कैस्टर ऑयल भी बाल ग्रो नहीं करेगा?
Yes, definitely. कोई भी ऑयल बालों को ग्रो नहीं करेगा. एक्चुअली हमारे बालों को, जैसे मैंने पहले भी कहा है कि हेयर इज हैविंग इट्स ओन ऑयल प्रोड्यूसिंग ग्लैंड. सो ऑयल की जरूरत नहीं है बालों को. बाल ऑयल का पर्पस सिर्फ कंडीशनिंग यही है. और जब भी आप ऑयल लगाए तो उसको पूरे रात भर ना रखे. डोंट कीप इट ओवरनाइट. You can apply once in a week. Yes, that's okay, but don't keep it overnight. Just wash 2 to 3 hours after oiling.
The same person is saying, are there any DIY for hair treatment safe? Okay, like home, and is there any home remedy which is safe for keeping hair healthy?
Any DIY? Yes, you can use egg as a conditioner.
Okay.
Yes, and lots of masks. Nowadays, people are preparing by themselves by using banana and curd and mixing them. But I don't know how much beneficial they are. But yes, egg is a good conditioner
Okay.
if you tackle with the smell of that part.
Okay.
Yes.
Okay. The same person who had androgenic alopecia, he's asking, डॉक्टर मेसोथेरेपी क्या होता है? मेसोथेरेपी से मेरा हेल्थ हो सकता है क्या?
मिजोथेरेपी मिजोथेरेपी एक ऐसे सॉल्यूशन रहता है जिसमें ग्रोथ फैक्टर्स रहते हैं, एंटीऑक्सीडेंट रहते हैं, जो आपके बालों को थिक बनाता है. जो थिन आपके बाल हुए हैं उनको मोटा करता है. So of course, mesotherapy will help in making hair thin in case of thick in case of androgenetic alopecia, and of course, they help in growing hairs.
Okay. Okay. मतलब एंड्रोजेनिक एलोपेशिया में मेसोथेरेपी भी हेल्प कर सकता है?
Yes.
Okay. Because we are running out of time, so I'll just take quickly a last question, doctor.
Yes.
Doctor, I heard that Ayurvedic henna mehndi can be used for having a good hair health, and even I have gray hair, so color is better or henna is good?
हम दोनों भी यूज कर सकते हैं. हिना भी यूज कर सकते हैं, या तो फिर एनी कलर लाइक वेजिटेबल डाई प्रीफर कीजिए यूज करना, या तो फिर अमोनिया फ्री कलर जो रहते हैं वो भी आप यूज कर सकते हैं. हिना बेसिकली अलोंग विद द कलर वो कंडीशनिंग इफेक्ट देता है, थोड़ा स्मूथ शाइनी बनाता है हेयर्स को. सो यू कैन गो फॉर हिना ऑल्सो.
Okay, doctor. So, doctor, would you like to give a take-home message or any other suggestion to our viewers today?
So see, my suggestion is that hair treatment is not same for everybody. It's not like that कोई एक solution use कर रहा है to grow hairs, तो वो solution अगर मैंने भी use किया तो वो मेरे बाल उग जाएंगे, ऐसे बिल्कुल भी नहीं रहता है। और वार्निंग साइंस, जैसे वार्निंग साइंस में जैसे बॉल्डनेस दिखने के पहले भी हम फील कर सकते हैं कि हमारे बाल पतले हो रहे हैं, वी आर गेटिंग थिन आउट हेयर, सो तब आप कंसल्ट कीजिए डर्मेटोलॉजिस्ट को, क्योंकि बहुत सारे पेशेंट ऐसे रहते हैं कि जिनको ये सब चीजें पता नहीं रहती एंड देन दे लैंडेड अप विथ द एडवांस ग्रेड ऑफ एलोपेशिया। सो उसके पहले अगर हम कुछ कर पाए तो डेफिनेटली ये बेनिफिशियल रहेगा।
Thank you so much, doctor, for sharing so much of information and all your expertise with us today and answering all the questions of our viewers today. I'm sure our viewers have been benefited by this session. Thank you, doctor. It was delight to have you, and thank you so much for your valuable time.
Thank you so much.
Thank you, ladies and gentlemen, for joining us today. This is Mona Sharma, your host, signing off for today. Thank you, doctor.
Thank you.